and welcome to In Your Prime. I'm Jana Collier, publisher of the Dayton Daily News, the Springfield News-Sun, and the Journal News. We're so glad you're with us for In Your Prime. Today, we're out in the community talking to local experts who are going to inspire and empower us to live our best lives. Right now, we're at the YMCA in Xenia to talk with Sheehan about creating a life of wellness. Next, we'll visit the Kettering Health Years Ahead Health Center in Centerville, and we'll take a closer look at how women can protect their bone health and talk about living with diabetes. The Southwest Ohio region is the perfect place to live at any age, but especially for us in the prime of our lives. So let's get started. Right now, we're at the Greater Dayton YMCA in Xenia, and we're talking to Sheehan, who's the Director of Senior Health and Wellness. Kim, welcome to In Your Prime.
Thanks.
Kim, tell us a little bit about yourself.
So I'm the Health and Wellness Director here at the Xenia location. I oversee all of our health and wellness programming as well as our senior programming. And then I'm a certified personal trainer and Group X instructor. I'm Silver Sneakers instructor, so I get to wear a lot of hats in our building.
So obviously, physical activity is important at every age, but I think it actually gets more important as we get older. So tell us about the benefits of exercise for senior adults.
Yeah, there are so many benefits for exercising at any age, but especially for a senior. So one thing that you want to really focus on is your strength, because building strength is going to be great for your daily life and improving your independence. You're also going to want to focus on your cardiovascular health, and some core and balance work is going to definitely help prevent a lot of falls. It'll also increase your energy, and it will help you delay or prevent some illnesses like diabetes or osteoporosis, and it's going to improve your mental health and help boost your mood a little bit to help fight off some depression. So it's great in all aspects of your life.
So one way to get more active is to join a gym, like the YMCA. Why is that a good choice for seniors?
I think that joining a facility like the Y is great because it's going to offer you a variety of programming, whereas if you were going just to a 24-hour fitness center or something like that on your own, you might not know exactly where to start. And if you join a gym or a facility like the Y, you're going to have classes that are like Silver Sneakers, and there will be increases. So you could go from a Silver Sneakers class to maybe a Zumba Gold class or try a chair yoga class, and there are a lot of options available.
What kinds of programs and classes are available here at the Y?
At the Y, depending on which branch you go to, you're going to see a variety of classes. So all of our branches offer Silver Sneakers classes, which are great because those are laid out by people that design classes for active older adults. So if you were starting out, you could do something like a Silver Sneakers Classic class. They have cardio, strength, a little bit of balance, a little bit of cognitive, and you can see kind of what you enjoy, because the most important part of taking a class and exercising is finding something that you want to do, because then you're going to keep doing it. So you can pick what your areas that you like the best are, and then you can go to classes that are more focused on that type of exercise. So if you really enjoyed your stretching in your Silver Sneakers Classic class, you could go to something like a chair yoga class, or if you really enjoyed the cardio portion, you might want to try like a Zumba Gold class, which is more of a dance-based class. We also offer different activities for seniors to take. So we have pickleball at our location and beach ball volleyball if you're more into like a team sport or something like that. And then if your joints just aren't ready to be on land, you have the option of going to a water class. So you could try a water aerobics class or an arthritis aerobics class. So there's a wide variety of classes that you're able to take.
When someone hasn't been active for a while, then joining a gym can seem kind of intimidating. Walk us through what the experience is like when someone joins the Y.
Yeah, so when somebody joins the Y, first thing they're going to do is just come into our front desk and explain what their needs are. Once they decide on what type of membership works best for them, our front desk has a group exercise class schedule in front of them. They can walk that person through all the classes that might be a good fit for what they're looking for. We also, at the Y, we'll do a fitness orientation that's free for the members. So we have a person that's staffed in our fitness center that can walk them through different exercises, different types of machines, and kind of get them over that hump of being a little bit fearful fearful of what going into the gym is going to be like. We also have a program called Active Tracks that is free to all of our members. The member just schedules an appointment at the front desk with one of our fitness counselors, and that fitness counselor will walk them through a very basic strength test, and they have an algorithm and a computer. So they plug in the results of that strength test along with what that person's goals and limitations are, and it'll build a strength training program for them that's really easy to follow in our fitness centers.
So is a membership affordable for seniors?
Oh, absolutely. A lot of seniors might not know this, but if they have supplemental insurance for their Medicare, that sometimes will cover the cost of their membership depending on what plan they have. So there are a lot of different options that your insurance company might use. We have Silver Sneakers, Silver and Fit, Renew Active. So just check your plans to see if those are part of it, and your whole membership might be covered. If for whatever reason you don't have a plan that covers it, we do have financial assistance available. So they would just stop by the front desk and let them know, and they would have to fill out a little bit of paperwork, but we can usually get the cost down pretty low for people with a limited income.
That's great. I think people will be really glad to hear that. So we're going to take a question from viewers. A lot of viewers seem concerned about injuries. Either they are afraid they're going to get injured, or maybe they have a past injury. So what are some things that the Y does to make sure that classes are safe for seniors?
Yeah, so we do hire certified group exercise instructors. So sometimes that's a general group exercise instructor certification, and sometimes it's very area specific. So a lot of our active older adults classes, like Silver Sneakers, they are Silver Sneakers certified. So that means that they are trained to know what those types of injuries that seniors are most concerned about are. They will also make modifications to the exercise programming. So usually they show you kind of like a baseline and then a step above that's a little bit harder and a step below that might not have as much impact or might be a little bit easier on balance. And then for some of our senior classes, we also offer a chair option. So if you have folks that are a little bit worried or nervous about falls or things like that, they have the option to stay seated when they do the exercise.
So let's take another viewer question. So for someone who hasn't been exercising, maybe, how much exercise do they really need to do to get started?
So if someone hasn't been exercising, any amount of exercise is going to be better than none at all. So if that first step is maybe just one day a week, I'm going to go to one class a week, that's great. That's a wonderful step. We'd probably want to see them about 3 to 5 times a week, but that doesn't necessarily have to be formal exercise. It could be maybe you go to 3 Silver Sneakers classes a week, and the other 2 days you take a walk or you garden or you do something else that's active that you enjoy.
So it's been so fun to see people so active here. We've seen people playing basketball and pickleball. Tell us about the community here and what it feels like to be here.
Oh, the Y is great. It's wonderful. You're going to develop a lot of friendships just by coming to some of the regular activities that we have going on here. So a lot of times, let's say somebody is missing from class, that class will know that that person is missing, and they will call them or text them and make sure that they're okay and that everything's going all right. If I'm teaching a class and I didn't know that somebody was going to be out of town, somebody in that class can tell me exactly where they are and what they're doing and what they're having to eat that day. So they are a very tight-knit group in each of their little nooks of the Y. So my water aerobics ladies, they sometimes will go out to lunch after classes. It just kind of depends on that particular group. We also do have a lot of great activities where seniors will just feel a sense of belonging. So if they're coming to the regular group exercise classes or playing pickup pickleball, they're going to make a lot of friends. And we have some friendly competitions. So every year we host something called the Senior Showcase, and it is where all of the Greater Dayton YMCAs send their seniors, and they compete in a variety of events. So they have more athletic events like running and walking and swimming and throwing things. And then they also have team sports like pickleball or beach ball volleyball, and they also have some non-athletic activities like card games. There's rock, paper, scissors competition, and a line dance contest. So they have a lot of different options of ways to meet new friends.
Wow, that sounds like a lot of fun. Sounds like a great place to be. So this has been so much great information. If someone is ready to take that next step, what do they need to do?
They have a lot of options. So one option is to check out our website. If you go to DaytonYMCA.org, you can find information about all of our 12 Greater Dayton locations. They could also just give a call to whatever YMCA is closest to them. That information can also be found on our website. And then they can also stop in. So the front desk at every branch is ready for new folks to come in and to talk to them about membership.
Well, Kim, thank you so much for joining us today on In Your Prime.
Oh, thanks for having me.
This program is sponsored in part by Kettering Health.
You've always looked forward to the years ahead. Say hello to healthcare that's with you every step of the way. Primary care for 65 years and older, with imaging services, wellness checks, prescription and nutrition help. From caring providers that understand your needs and concerns. All of it at a pace and schedule that fits your lifestyle, because our focus is on you. Kettering Health Years Ahead Primary Care, helping you look forward to the years ahead so they can be your best.
Our sponsors make this program and In Your Prime possible. Thank you to Kettering Health and the YMCA of Greater Dayton. And now we're here at the Years Ahead Health Center in Centerville. It's part of Kettering Health. And today we have Dr. Muna Jneidi, who is joining us to talk about bone health for women. Dr. Jneidi is an internist and she specializes in geriatric health. Welcome to In Your Prime, Dr. Jneidi.
Thank you. Nice meeting you, Jana, and I'm so glad you guys are here in our center.
Thank you. Well, so the Years Ahead Health Centers are specifically geared towards senior adults.
It's actually 55 and older.
Okay. Tell us a little bit about what these centers are and why they're unique.
They're unique because they care for a special population. It's 55 and older, where we see more chronic disease, especially with aging people. So we have to target them in kind of different ways. So in this center, we provide services that usually clinics don't provide. Like we have a social service. We have a program where we can provide, for example, yoga for elderly. We do lectures for community. So we did like breast cancer, so it's actually two sections. The clinic, which the doctors see patients and take care of them, have social services and have follow-up after hospital and things like that. And then we have the program where it's really focused on community. Anybody can come and see our lectures, participate in our yoga sessions, and if they need help with something specific, we do offer sessions for that.
That's so interesting. Thank you. Thank you for telling us about that. And I'd also like to hear a little bit about you. Tell us about yourself and how you got interested in medicine, specifically helping older adults.
So actually, I was 6 years old when I told my dad I'm going to become a doctor. I never changed my mind. When I did my residency in Pittsburgh, UPMC, Shadyside Hospital, the population there is more elderly. And I had a clinic as a resident, and my patients were more elderly. And I found it very rewarding. Now, first, you have to treat them differently. They're older than you, so they have to gain your trust. And once they do that, they trust you with so many things. They sometimes come to you with personal concerns and like things, what would you tell me to do? So it's very rewarding, and treating them, it's different than just treating regular adults. You have to be careful with medicine you give them. There's a lot of social aspect into their care, like sometimes when they lose, like a husband lose his wife, and how can you get them help at home? And it's actually very, very rewarding. And I'm actually board certified in internal medicine and geriatric medicine. Yeah, so I love my job, let's put it this way.
It shows. And that's wonderful. Thank you. So today we're going to be talking about bone health for women. So let's start by, tell us why that's important. Why should women be concerned about their bone health?
Because fractures, especially fragility fractures, fracture that happen not because of a big fall or a major trauma, can cause a lot of deconditioning, meaning like some people need to go to nursing home because they won't be able to stay at home after they have a fracture. They need more care. it increases the cost. It can make people decline in their health. And it's very common, and it's different in regions. Like, for example, the hip fracture can happen up to 600 per 100,000 women in certain areas. Vertebral fracture is higher than that, like 1,400 and 100,000. So it's common. It's something we should be aware of, and we should try to prevent it and try to diagnose it when it happens and then treat it.
Yeah. So why are women in particular, why are their bones so fragile?
So it's interesting. Men, as they grow, they reach a more like a higher bone density at a later age. Women get to the like targeted bone density in a younger age, and their bones are thinner than men. The estrogen level in women go down very sharply after menopause, while the testosterone in men goes down gradually. So that's why women have more chance to have osteoporosis and osteopenia compared to men. But there's something to mention about that. The mortality in hip fracture is actually higher in men than women. Yeah, and I think that's because probably if men have osteoporosis, it's an older age, so they have more issues.
And that is one of my questions. So can men have osteoporosis?
Of course. So, of course they can have osteoporosis. I think the major issue with us doctors is we do not make men aware of that. We do not, like, we focus on osteoporosis and women after menopause. We do not pay a lot of attention to men with osteoporosis. So yes, they can get it, and we should always get their attention to that and screen them when they need to be screened and treat them when it's appropriate.
So how do you assess bone health? And are there certain conditions that you're looking for?
So there is a certain condition where you should screen for osteoporosis. For example, there are specific medications that can make a decline in bone density and increase the risk for osteoporosis and osteopenia. A very common medication we all use for heartburn, known as Prilosec, can block the absorption for calcium and vitamin D, and that can cause increased risk for osteoporosis. So usually osteoporosis does not cause any symptoms unless you have a fracture. So like people get confused between osteoporosis and osteoarthritis, which have knee pain because of arthritis. Osteoporosis does not cause pain unless you have a fracture. So if a woman has a fracture for no clear reason, definitely they should come and check. Women after age 65, they definitely should, after menopause. And then again, people who take certain medications, we have patients who take steroid for different reasons. Steroid also can cause osteoporosis. So those people, we need to screen them. Screen them is by doing a test called DEXA scan. And I do it, I try to make it simple for the patient. And I say it's like measure of how strong your bones are, how dense they are. And so we get specific x-rays, and then we get these numbers, and then we compare it to somebody with normal bone density. And then the difference between the two numbers is how we measure how somebody has osteoporosis or not. So there's osteoporosis and there's osteopenia. Osteopenia is a condition before osteoporosis. The numbers are not as bad as osteoporosis, but they can increase your risk for having a fracture.
So is osteoporosis what causes people to get shorter as they get older?
Yes, so the bone shrink. And actually people come to the office and say, I used to be 5'8", and now I'm 5'7". Yes. And actually that's sometimes why people feel I have an abdomen now, because they're shrinking, so the vertebra, the spine is curved differently, and so they kind of lean forward, and that's what causes what they say my abdomen is bigger. But they actually, their bones shrank.
So how do we prevent osteoporosis?
So we prevent osteoporosis by eating healthy. Osteoporosis is common in underweight women, so make sure you have a normal weight. So eating healthy, regular healthy diet, taking enough calcium and vitamin D. If a woman smoking is a risk factor for osteoporosis, they should quit smoking. And then what do we call weight-bearing exercises? We're really not talking about a lot of heavy exercises. Walking is enough. 30 minutes walks, 5 days a week is very good to maintain bone health. Like, running is not better than walking, studies found. So walking, something simple. We really don't need to join an expensive gym. Or sometimes I tell my patients, like, hold a water bottle and just while walking, make sure you're doing that. Or some people put like heavy shoes on and walk with it. So it's very important to keep active.
Great.
And that's also improve the balance, because why do people fall? And their balance is shaky.
So let's take a question from one of our viewers. So this question from a viewer is, can we recover from osteoporosis?
I really don't see that, probably twice in my life as a doctor, and I've been a doctor for a long time. When we look at treatment, we want to do one major thing is to prevent fracture. So if the numbers of the bone density are the same or improved, then that's a success. But if they're worse, then what we're doing is not helping, and we have to do something else.
So does everyone get osteoporosis as they age?
No, not everybody. And you'll be surprised, I have 70s and 80s, and they don't have osteoporosis. So it really depends on so many things. Again, healthy diet, regular exercise, family history, if they're smokers or not. There are certain races have more chance of getting osteoporosis compared to others. So no, not everybody have osteoporosis, but it's something we can screen for, and we can prevent it from getting worse. So it's very important to make the population aware of this.
Well, Dr. Jneidi, thank you so much for joining us today on In Your Prime. This was such helpful information, and I know it meant a lot to so many viewers today. Thank you.
Thank you for coming to our center, and thanks for giving me this chance.
Our next guest is Christy Farkash. She's a nurse practitioner who specializes in endocrinology and diabetes care here at Kettering Health. Welcome to In Your Prime, Christy.
Thank you.
Tell us about what is endocrinology and how did you get interested in it?
So I've been a nurse practitioner for 6 years now, and I started my career actually in the urgent care setting. And I really enjoyed that kind of quick interaction that you'd have with patients, figuring out what's going on and treat them. They get better quickly. But I really craved that follow-up that you could have in the chronic care setting. So endocrinology is a field of medicine that focuses on the endocrine system, which is the part of the body that regulates all of our hormones. So that can impact things like bone health, heart rate, blood pressure, reproduction, thyroid, and diabetes, blood sugars. So a whole world of options in endocrinology. And what I focus on is diabetes. And I love it because it provides an opportunity to do what I was craving and follow up with patients and make an individualized plan for them and cheer for them along the way to help them reach their goals.
That's wonderful. Well, I can tell you're really passionate about this. So why is diabetes such a concern for older adults?
So if we think about just kind of the normal processes that happen as we age and kind of how our lifestyles change, maybe our routine that we used to do changes. We're not going to work first thing in the morning anymore. We have a little bit more free time. Maybe naturally our level of activity starts to slow down. So we're sitting down more, we're burning less fuel. As that happens, our weight can creep up. I think as we age, we also tend to indulge in some more delicious things than maybe we used to, because maybe we think, oh, I can do this now. So we're moving less, we're burning less, we're maybe consuming a little bit more. And all of those things are lifestyle factors that increase our risk of developing type 2 diabetes as we age. The complications that we see with type 2 diabetes and issues with vision and balance and memory are some of these normal things that we experience when we age as well. So they can actually happen faster and be a lot worse when we also have diabetes going on in the background.
So what does it mean to say that blood sugar is elevated, and why is that harmful?
So when we say blood sugar is elevated, what we're describing really is that sugar is hanging out in the wrong parts of our body, which can cause damage over time. If you picture our body as being made up of a bunch of organs that have these tiny little delicate tubes in them, these little vessels that are very fragile, and then you picture sugar as being big and sticky and hard, you can imagine that if too much of these big, sticky, hard sugar molecules are on these tiny, delicate vessels, it can cause damage over time. There are parts of our body that are most susceptible to that damage, like the eyes and the nerves, those little vessels around the heart. And these are some of the complications that you hear about diabetes patients having over time if their blood sugar is too elevated, if that sugar's in there causing damage to these little delicate places.
So how does a diagnosis of diabetes change your life?
I think it's really important to recognize that diabetes is a progressive disease. I think sometimes when we hear the word diabetes in our minds, we can jump straight to insulin or straight to these terrible complications that we've heard about our friends and family members experiencing. I've had people say before, I have diabetes, does that mean I have to start dialysis? No, these things, diabetes being a progressive disease, it may look very different at the time that you're diagnosed as it continues over the lifespan. So diabetes being a disease that responds a lot to what we do in our lifestyle can impact how we eat, how we drink, how we interact with each other. If you think about how many social events are developed around eating, when we have diabetes, we have to start thinking about those things differently. And depending on where we're at in our disease process, we might require different medications that are taken throughout the day. We may have to check our blood sugars, but it really starts to make you think more about what I'm doing in my daily life, how I'm eating and interacting, and how I'm moving my body throughout the day.
So it sounds like aside from medication, these are really key factors around exercise and diet. So let's break that down a little bit. Talk to us about how diet affects diabetes and what people should be doing.
I think this is a good opportunity to take a close look at what we're consuming and to look out for simple carbohydrates or added sugars. One of the ways these sneak themselves into our lives the most is through the things that we drink. So if you imagine a can of Mountain Dew, it has 10 teaspoons of sugar in it. It's wild. So imagine as you're going throughout your day sipping on this can of Mountain Dew, it's as if you've turned on a little faucet of sugar dripping into your body, causing the damage that we described earlier all throughout the day. It's really difficult for our bodies to overcome the blood sugar spike that something like that causes. So taking a close look at the things that we're drinking, looking for those added sugars. Processed foods are another high culprit, things that come out of boxes and packages. Those tend to have more added sugars. Of course, those desserts and the treats that we consume. Taking a close look at those things and trying to lean more into whole foods with a good balance of proteins and fats can help us feel fuller longer and more satisfied. And those are really stabilizing to our blood sugars.
So I know one thing that people worry about if they have a diagnosis of diabetes is they want to go out. They want to, enjoy going out with friends and eating out. I mean, do you have tips or suggestions around how people can manage that?
Absolutely. Don't stop socially interacting. Don't stop going out to eat with friends and family. I think that's super important. But the wonderful thing now is that lots of menus are available for us to look out ahead of time. So planning ahead can be super helpful. Take a look at the menu and make your choice before you go. That can be something that helps. Portion control when we're at the restaurant is huge. We are blessed with very generous portions often with where we go. So it can be helpful to either split the meal with the person that you're with, or maybe you order a to-go box when you sit down and just go ahead and plan to separate half the portion as soon as your food comes to the table. Set the to-go box aside for later, and then consume the whole portion of what's in front of you. You'll be satisfied feeling like you've eaten all of your meal. You'll have some for later. Another thing to consider is what you drink when you go out. Again, sipping on sugar has a huge impact. People can stop medication sometimes when they just turn off that drip of sugar. It's very, very powerful. So thinking about the choices that you make and what you drink as well. And one more tip that I love and I think is super important: don't go starving. Remember that when you sit down at the table, it's gonna take a little while for you to get your food probably. You're gonna be waiting. So if you've starved all day preparing to go out to this place, you'll sit down and be very prone to eat more than you intended to. So don't go starving. Maybe have a handful of nuts before you go into the restaurant, a cup of water when you sit down, and those things can help you stick to your intended proportions when you go out to eat.
So it sounds like diet is a very important part of the puzzle, but it's only one piece. Exercise is this other important factor. So tell us about that, about exercise and why it's important.
If you take just a short walk after you eat, all of a sudden the muscles that are helping you walk say, hey, I need the energy. Your cells will be unlocked, the muscle cells will be unlocked by the insulin, your blood sugar goes down, and your energy is not stored in fat, but rather it goes into muscle to help you do your activity. The activity doesn't have to be heroic or bodybuilding. It can be a brisk, like just a walk after you eat for 5-10 minutes. It can be taking soup cans in your hands and pumping your arms after you eat. Every bit of movement counts, but it gets to the heart of diabetes. It helps those keys unlock the cell, lowering the blood sugar and helping us better utilize the energy.
So let's take a question from one of our viewers. So here's a question from a viewer. How could I stop myself from eating so much sugar when I like it so much?
It's a very good question, and I think it's one we all ask ourselves. I think in this case, it's really important to remember that deprivation can lead to excess. If you tell yourself no, never, what's the first thing that you want? It's that which you've said you can never have again. So again, this is a time when planning really, really helps. I think if you know that you love ice cream, and maybe your practice right now is to have ice cream every night, the first thing to ask yourself is, how am I getting this ice cream? If it's in your freezer, that may be a really good place to start. I love ice cream and I want to cut down on the frequency that I'm eating it because I really want to help protect my health in the long run. I'm going to remove ice cream from my freezer and I'm going to allow myself to go out to get ice cream, just a cup or a cone, just 1 day a week. Immediately, you've taken 6 days of a sugar drip of ice cream out of your routine, and that'll make a really, really big difference. So portion control is really crucial.
So how does someone know if they have diabetes?
It's a great question. The sneaky thing about high blood sugars is that they don't always feel bad. And so this is where it's really important to be keeping up with routine appointments with your healthcare provider. Get those screenings that they recommend when they recommend them. Keep up with blood work and health maintenance. That's really important. But there are also some signs that we can look out for that would suggest that our body is trying to lower our blood sugar on its own. So when your blood sugar is very high, you may find that you're urinating more frequently because your body is trying to flush out that high sugar. You may find that you're really thirsty because your body is trying to dilute the sugar that you have in your bloodstream. You may find that you're really hungry because the cells that really need energy aren't getting what they need. So if you find yourself facing those symptoms more than normal for you, it would be a really good idea to talk to your healthcare provider about that.
So for those who are living with this disease, what would you recommend so that they can maintain the highest possible quality of life?
I think it's really important to feel empowered, and that's one of my favorite conversations to have with people. How can I feel like I have a sense of power over this disease? Diabetes is a disease that responds so much to how we choose to live. Those choices that we've been talking about as far as what we choose to eat, what we choose to drink, and how we choose to move our bodies, those are all within our wheelhouse of control and things that nobody else can take away. So even if you find yourself really struggling with pain and you're not able to get up and move a lot, maybe you spend most of your time sitting because of other diseases that you have going on that you're managing. Think about ways that you can continue to incorporate these empowering concepts in your daily routine. If your back is bad and you're in a wheelchair, maybe you can use your arms to move those muscles after you eat. It's super, super powerful. If somebody else plans your meals for you, maybe you can talk about what is it that we're adding to the meal and the things that we're drinking or the sweets that we're having. Those little changes make a huge difference and truly can slow down the progression of this disease, giving you some power back.
Thank you so much for joining us for In Your Prime.
My pleasure.
Thank you for watching In Your Prime, and a big thank you to our sponsors, Kettering Health and YMCA of Greater Dayton. Our sponsors make it possible to bring you this important and informative advice and guidance from local experts right here in our communities. Visit our website for more information on these subjects and so much more to help you make the most of living in your prime.